I'm Emily Wolfe. I'm a plastic and reconstructive surgeon with a lot of focus on breast reconstruction and cosmetic procedures. Also doing some reconstruction in the way of bariatric surgery, in the way of peniculectomies and body contouring procedures after they've had their weight loss. In the way of plastic surgery, I grew up in a medical household. I shadowed a plastic surgeon at 17. I took private art lessons for 12 years, which is actually a huge part of it. My residency program actually had us take art lessons where we had a 6 weeks course on drawing, photography, and sculpting, which helps foster all of the 3D and the cosmetic aspects of plastic surgery and reconstruction. So here at the surgery group, there are a group of bariatric surgeons and also a group of breast surgeons who will remove their cancer or perform a procedure in order to make people lose weight. After that's over, people need to be restored to their whole self. And with that, I'm able to, in the case of bariatric surgery, do something called a peniculectomy, where we take off all that extra skin or lift it or tuck it, whatever we need to do in order to make their body feel natural again. And with the breast surgery, after having a mastectomy, a lot of women feel not as complete as they once did, and we're able to give them back something that they had lost. My process with the women starts, on their first diagnosis. Usually it's at least a year-long journey for reconstructive to take place. And with that, we go through the mastectomy. There are lots of tears. We deal with chemotherapy and radiation, how that may affect their reconstruction and their reconstruction options. It's a group environment where we make all these decisions together, and we're able to talk about what's going to be best for them in their long term and what their goals are. And hopefully within about a year or so, they are feeling more like themselves. Their body has been put back in some kind of way that they are comfortable. In the way of breast reconstruction, there are two main types. One is an immediate and one's a delayed. And women can go about it either way. So they can choose to have their mastectomy or their lumpectomy and recover from the cancer point of view, and then come back even 10, 20 years later and decide, I'm not happy with this way this looks now. Insurance should always take care of that woman because she had a diagnosis of breast cancer. And at that point in time, it's what does the woman want? Does she need the breast lifted? Does she need a hole filled in? Does she need a whole reconstruction? There's several different ways you can go about these things. If you have a lumpectomy, your breast may not be the same size anymore. So you may need a small implant placed on one side, or you may need fat grafting, or you may just need a lift and a reduction to make both sides symmetrical. Those women who have mastectomies, typically we would start with something called a tissue expander reconstruction, where you put in basically like a little device that will slowly grow as we inject saline into it. And basically the woman's able to say, whoa, that's big enough, or no, I want to be a little bit bigger. So she has a lot of say in what the size and shape of her breasts are going to look like. So people who've had skin cancers removed and maybe in a not so great place, like in the middle of their forehead or on their nose, there's lots of plastic and reconstructive surgery that can go on in order to recreate and to fill in those defects. I love to do those procedures. They're little procedures for the most part that can be done in the office, so people aren't having to go to the hospital or be put completely to sleep for a lot of those things. The patients are usually very, very happy. They get their hole in their forehead repaired, so quality of life goes up immensely. If a patient's interested in having a cosmetic or restorative procedure, it is very easy to get in contact with us here. All they have to do is call and make an appointment. There are no referrals that are necessary. We'll determine whether or not it would be on the cosmetic end or versus the reconstructive end. We usually try to put most things through insurance, especially for people who are having some kind of deficit, whether it be missing a breast or having a hole in their head. We need to try to restore that to its fullest ability.